So the spinopelvic analysis isn't necessary if you get the prosthesis right. So if 40-20 is correct, maybe it's 40-15, then the stems will match it in any hip, in any patient, in any position of the femur, and in any position of the spine. And if you think about it, if you lengthen the femoral shaft or you shorten the femoral shaft, say by 150 mils, 6 inches, what difference does that make to the hip? None. Okay, so if you then do that osteotomy where you're either lengthening or shortening the femur, instead just rotate it 90 degrees if you like, so the foot's pointing sideways, inwards or outwards, I don't mind. What difference does that make to the hip? None. So we have all this rubbish about, and by the way, normal version is supposed to be -19 to +33 degrees. Rubbish. It's not. You're describing variation of human anatomy with respect to, one, the obliquity of the joint line of the knee, because if the knee joint line is, say, 10 degrees oblique, then the retrocondylar line of the femur is 10 degrees tilted as well. So if it's varus, then it's going to be internally rotated, etc. So of that so-called normal variation of hip version, it's not hip version at all, 10 degrees of it comes from the knee. And that's 10 degrees either way, so let's call that 20 degrees. The other thing, there's this variation in terms of the spine, spiral deformity, or the rifling of the femoral shaft. And most of that variation, that -19 to +33 degrees, that 50-degree range of hip version, it's not true. There's a 50-degree range of variation below the lesser trochanter, all outside the hip. And none of that matters to the hip. Restore the sovereignty of the hip.